It's usually just a tad bit delay, and I think we are getting ready. All right. Good morning, everyone. My name is Heather Kinsey, and I am joining you from the Strive Group in Anchorage, Alaska. Welcome to our daily webinars. If you're new to our webinars, know that we have a chat function available to you that'll be seen on the right-hand side of your screen. So if you'd like to text in a question, either for myself or for Josh today, please do so, and I will pop in, gently interrupt Josh with that question, and he'll answer it online. If you have a question towards the end of our 30-minute session here today, make sure that you have your email address in the question itself. That way we'll be able to contact you directly should Josh not have an opportunity to answer it while we're in the 30-minute time slot. So again, my name is Heather Kinsey, and I'm the Chief Operating Officer from the Strive Group. And with me today is Josh Weinstein from Risk Consulting. And his topic today is, hello. His topic today is employee health and wellness, specifically employer health programs, group health plans. And he's got, I don't know, probably 7 questions that have been frequently asked from his clients that he'll address here on the webinar, but you can, of course, ask your own through the chat function. You can also tune in on Monday for a similar webinar with the PPP. Josh will actually talk a little bit about another webinar that Risk is offering with the PPP later on in this session. Tuesday, we're still on the CARES or stimulus package content, but specifically on retirement and how the CARES stimulus package is affecting some things that you could do with your retirement withholdings and cash outs and stuff like that. So we're definitely CARES heavy today, Friday, and Monday, and Tuesday. If you have any ideas for future programming, you can email them to me at theinfo@strivegroup.com, or if you want to see what our programming is, you can visit our website for that schedule. But without further ado, I want to turn it over. Again, this is Josh Weinstein from Risk Consulting. And Josh, go ahead and take it from there. I'll pop back in as we have questions.
Sounds great, Heather. Thank you very much, and good day to everyone. Look forward to spending a little bit of time with all of you, helping with your questions that pertain to your group health and wellness or health and welfare benefits. I'm also joined with my partner, Andrew Kupperman, who focuses a lot on the human resource and technology side of the benefits world. One of the general questions that we're hearing a lot of from employers during the cash flow crisis that results when revenues are down is, can we get some relief with making premium payments to our insurance companies that we work with? And how do we go about getting that relief put together? Fortunately, the Division of Insurance in the state of Alaska issued a bulletin that made it very clear that any insurance policies that the State Division of Insurance regulates and oversees, those policies cannot be canceled for non-payment prior to June 1st. So once the governor made an emergency declaration in the state, all the way through to June 1st, those policies will not be canceled for non-payment, and claims will continue to be processed. So that's good news, allows us to take a deep breath, perhaps while we wait for some of this stimulus funding to arrive in bank accounts. Regarding those payments that are that are in forbearance, those premium payments will ultimately have to be made. It's not a waiver of those balances, but it does give us some of that temporary relief. During the time of forbearance, if you're not able to make your premium payments, we do still recommend having a dialogue with either your consultant or broker partner that helps you with your insurance policies, and or the insurance companies themselves, so they know really where you are at with your organization or business relative to your payments. Furthermore, once the June 1st date comes and goes, unless it's extended, then there's the potential, because you've had that dialogue, to work on repayment arrangements so that perhaps that lump sum of past due payments isn't due all at once. So keeping communication open is our recommendation, and we're just seeing a lot of flexibility in the part of many different insurers. One area I do want to caution some employers on is that many health insurance arrangements or dental plans, for example, are self-funded, which means that they're not under the purview of the Division of Insurance. And so this mandate or bulletin that I just referenced does not apply to all plans. So again, open communication with your broker consultant to see where we might have some premium flexibility or where those payments do need to be made and there's a risk of cancellation. Fortunately, some of our large health plans in the state, for example, Premera Blue Cross Blue Shield of Alaska, that insures more privately insured Alaskans than any other carrier, they have been very flexible even on self-funded arrangements or level-funded plans to work with their customers, as has Aetna. So good news on that side. I'm going to move on to the next question is, now what about continuity of coverage for plans when employees are unable to work their normal schedule? And that could be due to some of the leave provisions through the Families First Coronavirus Response Act, like the emergency paid sick leave or the emergency family medical leave, or through an employee who's furloughed because that work can't be done, or maybe even potentially a layoff or separation from employment. Well, with the federally mandated leaves, the answer is pretty clear, and that is if an employee is on employee paid sick leave or FMLA, either traditional FMLA or the emergency FMLA, then benefits do continue. And the employee's portion is still collectible. So that will come to in a moment as to how to collect premiums when someone doesn't have a full or normal paycheck. But the good news for your plan participants, for the employees and their families, is that their health insurance does have continuity during those protected periods of paid leave. What about in the case of a furlough, where an employee has a reduction in hours that could potentially push them south of the hourly requirement that you consider full-time as an employer? For many employers now, it's 30 hours a week, and that benchmark was really solidified through the Affordable Care Act. So if you have employees now who are down to 10 or 15 hours a week in the interim, they traditionally wouldn't qualify for benefits. So in that case, the same insurance companies that are having to allow you grace, if you will, with your premium payments, are also allowing a lot of flexibility with the for you as an employer to make the determination that you can continue coverage for employees who in any ordinary circumstances would no longer be eligible for the plan. So flexibility is given to the employer. Keep employees on the plan if it makes sense, or if your plan decision is to terminate them from coverage, then you can offer COBRA, or your if you're not subject to COBRA, then they would have their coverage turned off if that's your decision. My recommendation on that is just be consistent across your workforce for similarly situated individuals. So the continuity, in short, is protected during family first leave periods, and there's more flexibility for the employer to make a determination when there's a furlough, reduction in hours, or even a layoff. Typically with a layoff is when there's a separation of employment status between the employee and the employer, and that's traditionally where an employer would turn off benefits, offer COBRA coverage if they're subject to those rules. Again, employers still have that flexibility now if as part of a severance or part of a layoff to continue coverage. So a lot of opportunity to work with your broker consultant on a strategy that makes sense, specifically if you're looking to rehire those employees when we can open back up. Next slide is a little bit. Oh, sure.
Josh, that's okay. There's just a little bit of a question, and really it's mostly a clarifying question. But the question is, if the third-party administrator is working with the employer on sort of a repayment plan for these deferred payments, is it a safe assumption that the employer would then work with the employees sort of on a repayment plan once they are able to come back to work? I would imagine that as employees come back to work, even if it's only part-time, they're probably cash needy at that point. And so if the employer can not remove that huge employee portion of the premium, that's probably more beneficial to the employee. Would you agree?
Absolutely. And there's a lot of flexibility there for the employer and employee to work together. Generally, we like those benefit contributions to be paid through the employee's paychecks because that's typically done without taxation or on a pre-tax basis. Whereas if the employee needs to actually pay the employer out of pocket by writing a check or transferring funds back to the employer to pay for their share of insurance, that would be taxed dollars. But that can happen before the leave. The kind of a common scenario on traditional FMLA is how are we going to cover up to 12 weeks of benefit costs? Are we going to do it before the leave or upon return? So those same approaches take place here during the COVID outbreak.
Great, got it. Thank you very much.
Yeah, great questions. Next question is, we're seeing a lot from employers is the potential of opening the plan back up and allowing an open enrollment opportunity so that in the event someone who doesn't have health insurance was previously offered it, can they get on the plan now because they see particularly high value in having health insurance right now? And the general answer is probably not. And the rationale there is there's not a special enrollment trigger or status change just because of a pandemic outbreak. So federal law has not changed the parameters on when someone can hop on a plan in the middle of a plan year. There are definitely reasons, we traditionally call them special enrollment circumstances, but a pandemic isn't one of them. That being said, some health plans nationally have stepped back and said we are going to allow the special enrollment as a result of the pandemic, and we're going to do that and allow employers the decision as to whether or not they want to take it down to their workforces. For example, Aetna, Cigna, Humana, those are just a few of the national brands, United Healthcare, they have allowed employers to do this special enrollment circumstance. I just read an article this morning that really touched on, will that allow a pre-tax contribution? And probably not, because it doesn't really affect the federal, what we call Section 125 rules. So again, great thing if it's something you want to inquire about with your plan, talk to your broker and consultant. We'll look at the specifics of your plan documents and the partners that you're working with on your health insurance to make sure that that is a permissible avenue and that we do it compliantly. If you're self-funded, we also want to bring in the stop-loss insurers to make sure they agree to cover those risks associated with allowing people just a chance to hop on insurance mid-year. On the individual insurance market, states that run their own health insurance marketplaces have been much more willing to allow individuals and families to get a chance to enroll mid-year. So maybe you live in Washington State and you can't get on your employer's plan mid-year because they're not allowing this opportunity. Well, the Washington State Health Insurance Marketplace or Exchange is allowing an opportunity as a result of the COVID outbreak. Alaska is on the federal marketplace, and the federal marketplace has not opened up the floodgates yet. So we'll see if that decision gets reversed, but as of now, that's not an option for individuals and family coverage plans.
Got it. So Josh, there's another question. I apologize, but I think it's a good one and it's a good place to ask it. The question is specific to new employees that are coming on, whether they're temporary or whether they're, the employer is able to hire what would otherwise be known as regular employees. Are they able to waive that waiting period for eligibility to get someone immediately on the plan as opposed to their typical waiting periods?
Again, a good question, Heather, and that's a circumstantial outcome. Typically, employers ask new employees that are hired on a full-time basis to go through a waiting period. We used to call them probationary periods, but they can be anywhere from 30 days, 60 days, and then coverage will often start on the first day of the month following that 30 or 60-day waiting period. We have seen employers that modify their entrance date for their new hires, and that is potentially an option. But again, that's something that we need to get all parties in alignment. It would typically require what's called a summary of material modification on your plan documents. We'd have to just go through a few steps to make those changes, and then we have to decide: are we making this on a permanent basis, or is this something that we're just doing for a short window of time? But there's certainly some potential there, Heather. Next question we had here is, what should employers do to collect monthly premiums previously paid by employees if employees have defaulted to leave without pay, are furloughed, or otherwise? So this, I believe I kind of addressed this already, this is an arrangement that's struck between the employer and the employee. One thing for employers to know is they don't ever have to be in a situation where they are fronting or forward paying health insurance on behalf of their employees when the employee has an obligation. So for example, if an employer pays 75% of the costs and the employee typically pays 25, then we need to, if the employer chooses to, say to the employee, we need your 25% on a timely and regular basis, so we don't wind up 1, 2, 3 months out and the employee hasn't been able to contribute their 25%, potentially does not return to work, and then there's really not a mechanism to recollect those funds. So employers can manage their risk, their liability here, by having a strategy put in place for collection of premiums. Okay, next question is on coverage on the plans themselves. I've gotten a lot of clarity on this topic, which when we talked about this a few weeks ago, Heather, there was a lot more questions and answers. So COVID-19 testing and the associated visits when you go somewhere to get tested, those are going to be covered by health plans without any cost sharing. Cost sharing is the portion the employee pays once they're on the health plan. Things like deductible co-payments or the co-insurance, those are all waived for testing related expenses. And that's also for in-network or out-of-network. So we don't have to worry too much when getting tested about, are they part of our health plan's PPO arrangement. So getting tested should be there shouldn't be a financial barrier on any health plan that is self-funded, fully insured, large market, small group market, individual health plan, grandfathered, non-grandfathered. This was pretty broad from the feds, is we want to make sure Americans can get tested without having to worry about how to pay for that. Now, getting a test is a whole nother issue, but with respect to the coverage. If someone tests positive and they have treatments associated with COVID-19 or any other health issue for that matter, those are covered by health insurance policies. And here's where we've seen a bit of a deviation. Some health plans, for example, Primera, has come out and said, we're going to voluntarily waive COVID-related treatment costs from deductibles and co-insurance and co-pays. That is to say if someone were hospitalized or needed some medications or other treatments, that there's no cost sharing that the employee would have to pay. That's not necessarily going to be the case for self-funded employers who are given a choice as to whether or not they wanted to opt in or opt out of that cost sharing waiver for COVID-19 treatments. Other health insurers have been silent on the issue, and they are going to require employees to pay their normal cost sharing after testing is done and maybe the results are positive. So you can check with your broker consultant as to whether or not your plan is structured to waive the treatment costs for COVID-19. But testing universally is going to be, in the eyes of the employee, free. The treatment might or might not present some out-of-pocket liability for the employees. Next question is, as many providers are performing other tests to rule out other health conditions in an effort to isolate a COVID-19 diagnosis, are these tests covered under the same guidelines as COVID-19 testing? Typically not. So COVID-19 tests are cost share waived, as I just mentioned. But if the testing also involves testing for other conditions, I've not seen specific guidelines that say, yes, that other testing is absolutely going to fall under the codes. So the procedure codes that are associated with COVID-19 testing have been set up so that there's no copay, no deductible. But if the provider says, oh, maybe we think this is, I don't know, a vitamin D deficiency, or could be general some other health issue, those codes would not necessarily trigger a free health service in the eyes of the employee. But those testing services would apply to the employee's normal limits for the year, such as their out-of-pocket limit.
Okay, so Josh, I'm just going to interrupt you before you get to the telehealth question. And when I saw this question as part of the deck, I thought, this is a hot button. And sure enough, one of our questions says, "What? We don't have testing readily available." And so it is typical that the physician will do all of these rule out tests, right? And so I think what I just heard you say is that those would fall under regular plan provisions, and copays and cost sharing principles would apply, even though the person was presenting with COVID things, but there just wasn't a COVID test available. And of course, I'm not, I don't think that this viewer is blaming the messenger here. I think it's just wanting some clarification that currently that is the way it stands. So then my follow-up to you, Josh, would be, do you anticipate any changes to that as we move forward and these claims start coming in? Do you anticipate some loosening of that?
Potentially. There's always the opportunity for the insurers to go back and modify payment on services to the favor of the plan participant, and we certainly hope that that is the direction we go here. While you were asking the question, I went ahead and just pulled up Primera's, for example. They have a Q&A that specifically addressed these cost-sharing waivers, and I was going to read the some of the questions we're getting, like, for example, what about home testing kits for COVID-19? Are those covered? And right now, Primera is saying as of March 20th that the FDA released an alert to consumers about unauthorized fraudulent test kits. And, the answer is no, those are not covered because the FDA has not authorized any test that's actually available for purchase for testing yourself at home. What about drive-through testing? That would be covered because they are specifically testing for the COVID-19. What about the serology antibodies test? We're getting some questions about those. Those tests do need to be covered without cost sharing. So to determine if maybe you've already been exposed to coronavirus and have developed the antibodies. So that is a waiver situation there. Also waived are going to be the associated cost of the setting. So if you don't go to the drive-through facility, if you get it done in the emergency room or in a doctor's office and there's an office fee billed, those are coded to be waived. So I am hoping that we do get some greater clarity, of course, for members. Regarding testing for non-COVID, just again, I'll read Primera's language because they're really pulling from the feds here for the basic testing is the FDA authorized COVID-19, and then they also cover other influenza testing. So we're really just looking at flu tests and COVID-19, as well as the facility costs. All other treatments and services will be subject to the usual benefits and cost shares. So yeah, that could be very frustrating for the member, and I appreciate not shooting the messenger. With respect to telehealth, this is an area where we've seen a lot of growth because when we can't get elective healthcare services rendered because of state mandates, if someone has a non-COVID related visit or need, telehealth is an option. And many health plans provide telehealth, and they have a low cost of entry for the member. For COVID related telehealth visits, the feds have come out and said those are going to be covered as well. So telehealth is another avenue that you can look at through your health plan for having a conversation with a medical provider. But if that telehealth visit is someone has an unrelated issue, maybe they burned their finger or something like that, there's not going to necessarily be a mandated copay waiver. There still could be your normal cost sharing. So the Families First and then subsequently the CARES Act really came out and tried to clarify the removal of financial barriers related to COVID tests, whether it's and consultations around COVID through telemedicine. So it's a fairly limited tranche of freebies. And then some health plans have gone above and beyond and said they're going to allow coverage for full treatment, but that's a plan specific item.
So Josh, I'm so glad I'm not in your seat. I'm in the very easy hostess seat. But the next question is on mental health telehealth, right? So a double whammy here, and triple whammy, mental health is related to COVID. So take that answer away.
Sure thing. So many health plans have decided to waive telehealth copays across the board. The feds have said if it's COVID related, it must be waived. But again, health plans can go above and beyond. So in the instance of, just keep using Premera. I've got their website up here on my screen, but we work with all sorts of health plans. Aetna's doing similar things, United Healthcare, and it's really encouraging to see. But for example, Premera has said we're going to waive telehealth copays for all of their in-network telehealth providers. They've used Teladoc. They've expanded to include one called 98.6, Doctor on Demand, MyCare Alaska, which is being able to speak with an emergency room physician. So Premera specifically has like at least 4 vendors. One of their other vendors that they have for telemedicine is also a mental or behavioral health focused provider. And so by taking the approach that we can waive copays on these things and give people the opportunity to get no-cost healthcare through a new delivery system, typically your mobile device, is really fantastic. So this is again an opportunity to share that message with your employees. If you're an employer, if you're wanting to provide some assurances specifically to the behavioral health considerations as well, because we're all feeling some new things these days.
Right. And that made me think about another thing. I mean, many employers, whether they're in Alaska or otherwise, they have employee assistance programs as a benefit to employees, to active employees. So those types of programs, it could be grief counseling, it could be anger management, a whole host of counseling are available through would types of providers, or do you see those types of providers moving to a telehealth or a remote platform?
In general, yes. I think we all have heard the terms, the world's never going to be the same again afterward. I think we're going to see more and more telehealth. I got an email from an orthopedist because I broke my foot last year and I'm on their mailing list, and they said they're now doing telemedicine. Certainly behavioral health providers are working because not only of the historical stigma that goes with getting treatment for behavioral health, but just being able to log in. And we've all become a lot more intimate or familiar with these webinar or video conference style conversations. So I think these are here to stay, as well as the cost structure is much lower to do these because we don't have so many of the considerations of running a physical, a place of performing those services.
Right. Interesting. I'm really curious about in employee assistance programs and kind of diving more into those and seeing how they might be activated or otherwise changed due to an entire world moving very, very quickly to remote settings. So
yes, and in closing, Heather, on that topic, many employers don't even. I've discovered when we've begun work with a new client is they weren't even aware they had an employee assistance program because they're oftentimes tucked inside a policy that includes it as a benefit. Could be a life insurance contract for their employees or a disability insurance contract, and it includes a free employee assistance program that provides telephonic as well as even face-to-face visits, which in the new world means face-to-face telephonic. So, and they're free. There's no cost to the members, and they have other resources like legal and financial counseling. So they're very robust programs. Really excited to, we've been promoting those for our clients as well.
Right. Yeah. I remember way back when I was an HR director, and I was amazed at so many of my colleagues in the HR profession that they didn't know about the EAPs that their employers were offering and had purchased, right, for their workforce, and they certainly weren't promoting them and encouraging their users to get the full benefit. And I love that you had mentioned financial planning, because of course estate planning or advanced directives, I mean, these are now really top of mind for many of America's workforce. And I would strongly encourage all of the viewers to maybe dig a little bit and to see if your employer is offering that, and take advantage of this free of charge or low cost option now while it's top of mind. So.
Yep, and they're confidential and complimentary, as I like to tell our clients. So.
So it's C&C. All right. Well, listen, we're ending. We've just hit the 11 o'clock hour, so I will make my goodbyes very, very quick so Josh can take over. But I thank everybody for joining us live or via recording later on. Our live webinar programming is at our website, thestrivegroup.com, and also all of our playbacks of previous recordings can be found on the website as well. If you have any suggestions for future topics, feel free to email them directly to me at info@thestrivegroup.com. If I know of an expert that can handle, 28 minutes of rapid fire, I will, beg and plead for them to come and join us, just like Josh has joined us today. If I do not know of an expert, I reach out to my network and I find one for you. And that way you can have a webinar specifically made just for you and your curiosities. I encourage you all to stay positive and hug your loved ones if you're physically able to do so. Give them a virtual hug if you can't. Wash your hands, all of that good stuff. Josh, I'm going to advance it to this last slide, and I'll say my goodbyes and my thanks to you. Feel free to talk about your upcoming webinar on Monday that's following ours. Thank you for not competing with our time slot. And enjoy your weekend, and my blessings to your family. Thanks, everyone.
Well, thanks, Heather. Real quick goodbye for us is just thanks for the opportunity to visit, Heather. Risk Consulting, you can reach us at info@riskconsulting.com. We are putting on a wonderful webinar with the same presenter that's going to be on your Strive Group webinar. We're going to be bringing together a lender, an attorney, a CPA, as well as a small business SBA-related presenter to come and be panelists and talk about the CARES Act and some of the new potential funding that's coming for the famous programs like PPP and the economic injury disaster loans. Shoot us an email at info@riskconsulting.com. We'll get you an invite for that. Should be a very, very different type of session because of the format, bringing all those experts together with their interesting perspectives. So thanks, everyone. Have a wonderful weekend. Look forward to seeing you on Monday.